Hello, everybody. Thank you for joining us today. My name is Dr. Khalil Nasser. I'm here with Dr. Talati, local family medicine doctor in the community. We'd like to have an open conversation about podcasts and their potential. So, Dr. Talati, thank you for joining me today.
Absolutely, Dr. Nasir.
What do you think of podcasts?
I think podcasts have really taken over. If you look at some of the data, approximately 88 million Americans listen to podcasts in any given year, or rather for 2023. So, I, you know, not just medical podcasts, but podcasts in general. So, the utility of podcasts in medicine is wide ranging, from medical students to residents to those of us that have been practicing for years. They allow us to view, to listen on the fly. Most of us don't have a lot of time, but podcasts allow us to basically pause things, stop things, review things whenever we want to. We could be cooking and listening to a podcast.
And on demand, too.
On demand.
So, pause and pick it up where you left off.
Where you left off, exactly. So, podcasts can bring our colleagues together. For example, if a good article comes out in New England Journal and somebody's doing a weekly podcast, most of us don't have time to read New England the week it comes out. But if we got 15 minutes and they can give us the salient features of that article or that volume, bam, we're done. Mm-hmm. So there's a lot of good use for podcasts. New medical devices, for example. It could be a 5 or 10 minute podcast on how they can be used and why they should be used. Mm-hmm. For medical students, they can do grand rounds, for example. A lot of other things are from a perspective of management. If you could look at TED Talks in healthcare, there's a lot of good TED Talks that actually are quite longer than 15 minutes, but have a lot of good utility to them.
And people really do still make the time to watch those episodes for TED Talks.
Yep.
The demand is there. The thirst for knowledge is there. Podcasts offers definitely like shorter spurts to get you caught up quicker, right? Yeah.
Yeah.
What about the audience and the potential for reaching more than just the healthcare professionals?
Excellent. So this also provides a lot of benefit to patients. So if a local family doc or internist were to do a podcast, this brings them closer to their patients. It allows them to build trust with them and shows that the provider is at the top of his or her game because they're doing this. So it can be used for branding for practices. Mm-hmm. So it's not just for medical professionals. It can be used as a community tool.
Like an advocacy tool for outreach and targeting different populations that are hard to get to.
You can do a diabetes talk, either on as a podcast, as a live cast. There's so many ways to do it. If you can get the community involved, then the health of a community could improve.
Yeah.
Plus the trust that you build within the community.
It's interesting you mentioned that. There are patients already in queue that we have already asked for their permission to volunteer as patient testimonials, like episodes in the future. And I don't know how else that would have been done. How is that possible otherwise?
So help me understand.
Something like this venue.
It's they want to do a video Google review?
No. They're like you. They're going to sit right in your seat.
Okay.
It's a patient, and it's their testimony, their history, their experience.
Okay.
And since it's available to the public, it's giving somebody the opportunity to listen to someone that they may not have been able to hear their voice.
So almost their story or how their disease process evolved, perhaps got diagnosed, and how they got better. Mm-hmm. And how their interactions with the medical community.
So,
that's
the potential is almost limitless.
It is limitless.
Yeah.
Because if you look at the American College of Healthcare Executives, they've been having podcasts for probably 10 years.
Mm-hmm.
And unfortunately, we're, as physicians, as providers, we've kind of been a little behind.
Mm-hmm.
I listen to a number of them because of their length. 10, 15 minutes, I can listen to what while I'm going to the hospital, while I'm going to the other office. It makes it easy. So I think a podcast, for us, example, I think Dr. Bolivar did one on dengue. Very good podcast, right?
In Guyana.
In Guyana. So, up and coming infectious diseases. Or how do you diagnose? I mean, these podcasts could go to the community physician. How do we diagnose dengue? How do we contact the health department?
That's an interesting perspective, that you can also now have a kind of like a platform where you can disseminate information quickly to an audience that might be interested in hearing what you have to say.
You could, email your audience, whoever watches your podcast, say, hey, there's an update on dengue.
Yeah.
And please watch our 5-minute video.
Mm-hmm. So it sounds like you're regularly consuming podcasts, and so the market is being defined. Probably, would you agree that it's still being, it's in its early phase? It's evolving?
It's evolving, but I think there's a lot of regular podcasts. JAMA Network has one, New England Journal. One I listen to is Military Medicine. It's a weekly podcast I listen to. Then there's always these other ones. There's Health Analytics. So whatever you want, emergency medicine, Grand Rounds.
So let me ask you something. Now these are geared to a healthcare professional like yourself. What do you think is missing from their approach to podcasts? Do you think that maybe they're not producing content for other audiences?
Absolutely.
Okay.
Yeah. No. So what you said earlier, we can do podcasts in the community. So bring patients in or direct podcasts as patients. For the most part, these podcasts are professional to professional. If you look at some of our younger audiences, the Gen Z, they are putting off preventative care. Well, a podcast could be a good way to show them or inform them that, hey, you don't have to do an annual physical every year. And that's actually a USPTF guideline. You don't necessarily need to do labs every year. You come in, we can discuss what's going on in your life, and then based on that encounter, we can order labs. But it seems like Gen Zs are just putting off healthcare in general, and to some extent, I don't blame them. The cost of healthcare, namely their premium, it can be very overwhelming. Mm-hmm. So by doing a podcast, say, hey, you're a 25-year-old, this is what you need done, or this is what you need to look at. Did you get your vaccines? Your BMI is elevated. Have you done a A1C to make sure you don't have diabetes? Little things like that. But that might make them or turn them into a healthier individual if they recognize that, hey, I've got to make some lifestyle changes. And these type of podcasts geared toward patients might be a good segue into doing that.
Mm-hmm. Well, excellent. I'm looking forward to pushing further and seeing if we can innovate in this space. Thank you for being one of the inaugural, guests.
I think you've got a great idea.
Thank you. All right. Well, it's really.
We just need some of our colleagues to come on here.
Yeah.
And help us. So we do have spots available. I think our next availability is going to be in April. Mm-hmm. So.
Yeah. For the next one, I think. Well, you heard it here. It's going to be definitely a big one in April.
You guys are going to have to fight for a spot soon.
Yeah, registration's limited. But no, thanks for joining us today. Thanks, Dr. Talati, for talking to me. Hopefully we have more of these coming out on a routine basis, even if they're short, small ones like this. And looking forward to catching up with you guys in the next one. Bye-bye.
Thanks for watching.